My name is Frida. I'm going to be your nurse practitioner today. Can you please tell me your name?
Flor de María Vargas Rodríguez.
Is your date of birth March 3rd, 1953?
Yes.
Okay, I'm going to go ahead and do a head assessment on you. Okay, let me check your scalp. I don't see any infestation, any indentation, no masses. Everything seems symmetrical for me. Your face is also symmetrical, no facial droop. Can you go ahead and open your eyes against resistance? Can you frown your eyebrows? Very good. Frown your face. Can you please puff your cheeks? Very good. Okay. I'm going to go ahead and feel your temporal artery. Your temporal arteries, it's +2. Now I'm going to check the cranial nerve number 5, the masseter. Can you please clench your teeth? Okay, good. Can you open your mandible? Can you open your mandible against resistance? Perfect. Okay, Miss Vargas, I'm here again. Now it's time to assess your mouth. I'm going to go ahead and please open your mouth. Open, huh? Okay. The gums seem non-bleeding. Everything is pink. The mucosa is moist and nice and pink. The teeth are intact. I don't see any cavities, no odor. Okay. Second. Now I'm going to take advantage and check a cranial nerve number 12. Can you please take your tongue out and move it around? Okay, cranial nerve number 12 is intact. And checking also, can you open your mouth again? And checking the hard and soft palate and the cranial nerve number 9 and 10. Okay, the uvula goes up, the gag reflex is intact. Yes, perfect. And also I'm going to bring some water. Can you drink some water? Can you drink it? Very.
Ya ves.
Así no va a ser. Okay, Miss Flor, now we're going to go ahead and we're going to continue with our assessment. And we're going to inspect your eyes right now. I have here a chart, and I'm going to put a 20 feet of distance of you, and then you're just going to cover one eye. You're going to read what you see, and then we're going to proceed with the other eye. Okay, let me place it. Can you please cover one eye and read what it says here?
A, B, C, D.
Very good. Can you proceed and cover the other eye, please? Can you go ahead and read?
A, B, C, D.
Very good. So you have a 20/20 sight. That's perfect. Now I'm going to proceed and put this here. You're going to follow it, okay? You don't have any strabismus. That's great. Now I'm going to check the cranial nerves 3, 4, and 6. Perfect. Now I'm going to check a perla. We're supposed to turn off the lights, but because of the purpose of the video, I'm not going to turn the light off. I just want to see if your pupils are reactive to light and they accommodate. Perfect, they do. Perfect. I'm also checking the eyes. The sclera is white. The lacrimal is good. Eyelashes look normal. Eyelids are also good. I don't see any redness, any discharge on the eyes. It's perfect. Now we're going to go ahead and do our last test, which is the fundoscopic. Can you please place your finger in front of your face? Perfect. I'm going to go ahead put a light on your eye, and I'm going to approximate to you to check the red reflex, okay? That way I'm going to be able to see the retinal background. Okay, let me go ahead. The lights need to be off, but for the purpose of the video, I'm going to keep the lights on. I see the red reflex right now. I go ahead, I'm seeing the retinal background. Everything seems normal. Perfect. Okay, thank you, Miss Flora. Okay, Miss Flora, now we're going to go ahead and we're going to inspect your nose, okay? I will make sure your nose is symmetrical. Yes, I see that your septum is not deviated or anything. I'm sorry, I'm going to put some light here. I don't see any drainage, any polyps, no redness. Do you have anything that is bothering you inside your nose?
No.
Okay. I'm going to close one nostril. Breathe. Good. Now the other one. Breathe. Nothing bother you? No, right?
No.
Okay. Now we're going to check the cranial nerve number 1. That is the olfactory. I'm going to give it to the patient to see if she can smell it. What it smells like?
Vanilla.
Okay, perfect. So her olfactory nerve is intact. Thank you. We're going to go ahead and check your neck. Okay, I'm going to go and check the cranial nerve number 11. With this cranial nerve, I need you to put your head up and down, then from side to side, and then I need you to put your shoulders up against resistance. Okay, very good. So it's intact. I'm going to go ahead and check your trachea. It's midline. I'm palpating. Do you feel any tenderness?
No.
Okay, great. Now I'm going to go ahead and feel the carotid artery. Okay, +2. I'll go ahead and auscultate it. Okay. I don't feel any brood, no. Perfect. I'm also checking the thyroid. Okay. Thyroid glands. Okay, perfect. I'm going to go ahead and I'm going to touch the lymph nodes. Here is the preauricular, the postauricular, occipital, the parotid, the jugular, the submandibular, submental, the supracervical, the deep cervical chain, the postcervical, and the supraclavicular. Okay, they are all perfect. I don't see any inflammation, no lumps. Okay, Miss Flor, now I'm going to go ahead. I'm going to assess your chest. It's going to be a respiratory assessment. For the purpose of the test, like, needs to be the back exposed, but for modesty, I'm not going to expose her back. I'm going to go ahead, check your chest posteriorly, anteriorly, looks symmetrical for me. I'm checking her skin. It's intact. The color of the skin is normal. Also, I need to go ahead and check the phrenitus. Every time I touch you, I want you to say 99, okay?
Mm-hmm.
Say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Okay, I feel the vibration every time she said 99, so everything is okay. Now I'm going to check the diaphragmatic expression. I'm going to go ahead and percuss. Can you go ahead and inhale? You can exhale now. Bota. Okay. Now I'm going to go up. Perfect. I need to mark it here. So it's 2 centimeters on this side. I'm going to go ahead and do it here. Can you inhale? gonna exhale now. It's here, perfect. So it's also 2 centimeters because I'm measuring both sides. It's equal. And I'm going to check how the patient is breathing. The rate is normal. The pattern is regular, normal. She doesn't seem under any distress. She's not short of breath. That's perfect. Now I'm going to measure the thoracic expansion. Can you breathe in? Respira. Okay, that's good. And I'm going to take advantage and I'm going to auscultate her back. Respira. In and out. Para adentro y para afuera. Everything sounds clear. I'm going to check on this side. Respire. Bote. Okay, everything is sounding clear. Perfect. On this side, I'm sorry. Can you breathe in? Perfect. Okay, Miss Flora, I'm going to go ahead. I'm going to check your heart sounds. I'm going to check again for GVD. I'm going to check for the aortic, renal, iliac, and femoral arteries, okay? I'm going to go ahead and check your heart sounds now. Let me use my stethoscope. Okay. I'm going to go ahead and move your breast a little, okay? Perfect. Now it's time to check for GBD. I know we already checked when I check your neck. Okay, no signs of GBD. Jugular vein distension. I'm also going to palpate the aortic here, renal, iliac, and now femoral. Okay, and I'm also going to auscultate them. Again, aortic, renal, iliac, and femoral. I will check your upper extremity pulses, which are the radial. Perfect, they are +2, and the brachial, +2 pulses. Good. Now the lower extremities that we already checked, the femoral, then the popliteal here behind your knees, dorsalis pedis here, and posttibial. Or your pulses are +2. I don't see any swelling on your lower extremities, no edema, no pitting edema. The color on your lower extremities is normal, therefore you don't seem to have any vascular problems. Okay, thank you, Miss Flora. Okay, Miss Flora, we're here in the last part of your test. We're going to go ahead and check your ears. I'm checking that your ears are symmetrical. Yes, they're both symmetrical. The skin is intact. I don't see any lacerations. Do you have any pain when I touch here? On the tragus? Any tenderness? No?
No.
Okay. When I pull here in the pinna, any pain?
No.
Okay, perfect. Now I'm going to go ahead and I'm going to check the ear canal. Okay, seems intact. No redness, no inflammation. I see the eardrum light is at 5 here. Let me check the other one. The same, no inflammation, no redness, and the light here is at 7. Now I'm going to go ahead and going to do the brain test. I'm going to explain it to you. I'm going to put this near your ear. This is going to be position A. This is going to be position B, and you're going to let me know where you hear the most, okay? Where did you feel it the most? A or B?
A.
Okay, perfect. Now we're going to go ahead with the Weber one. It's the same thing. I'm going to do that sound and I'm going to place it here in the middle, and you're going to let me know in which ear you hear it the most or in the middle.
Medium.
Okay, perfect. Thank you, Miss Flor.